Hey guys, this is Lance, and I'm going to begin with the electronic claims submission part of Azalea RCM. One of the first things I look at as a revenue cycle account manager when I'm preparing to submit a batch of claims is the patient demographics. So let's go ahead and dive into the patient demographic dashboard. Here we have the quick patient search feature, which will allow you to quickly pull up a patient by their name or their patient ID. You can also see the financial status of the patient, whether or not they have a copay that they normally owe, or if they have an outstanding balance. You can also see the bill type for this patient, whether or not they have insurance or if they're self-pay. And if they do have insurance, that can be quickly accessed from the dashboard menu items here, as well as authorizations and billing history and the like. The fields down below here are expandable and will allow you to quickly access any of the clinical information on this or account information on this same page so that you don't have to leave this screen.
Next logical step from the demographics is to the encounters, and that's the billing side of the patient's chart. We use this encounters list screen internally. This is the screen that you would see as well, so that you can look over the encounters that are in the system and the claims that are being filed on those. It's very easy to batch up claims, so we're able to file claims very quickly. You can see here we just check off the claims we want or select them all, and we're able to create EDI files, paper claim files. So if we need to file appeals, we can do that in many different formats. We are also able to manage the claims effectively using our statuses, so we're able to quickly update all of these encounters to the new status. We're also able to search for any ICD-9 or CPT codes that we may need to use, and that's available for all of our clients as well. It's the full library of the current ICD-9 and CPT codes. We're also able to manage multiple patient encounters at once. You can see we have a tabbing system, so I can have 3 encounters open at the same time to be working through those. We also have filters that will allow us to effectively manage a single provider's claims or claims for a particular insurance or location. And then last but not least, before we file out any claims, we use this quick view feature, which will allow us to quickly see if all the appropriate modifiers and diagnosis pointer and whatnot are included on the claim. And we'll go over that quick view feature a little bit more in the demo later. I also want to point out that we have the pre-certifications, and that will allow you to include the pre-cert number on your claim, and we're going to go into that in more detail in the demo as well. Next, we'll talk about patient statements and insurance payments. Here's our insurance payments list screen. You can see a few things right off the bat. You have the insurance company's name, the dollar amount, so you can see how much you're getting paid from each insurance on each check, and you don't have to go search through a bunch of reports to find that. You can see it readily available under our payments screen here. You can also see if there's any alerts for any payments, so if we have a batch of payment that's out of balance, you can see that right here with the little red exclamation point bubble. You can also use the advanced search feature here, which is available on most of our screens, like the patient list, the encounters, the payments. It allows you to drill down even further to find a particular set of payments that, let's say, were created yesterday or have a payment date of yesterday or are of a particular specific amount. So you can find those payments very easily. Next, we'll talk about patient invoicing. This screen is a copy of the screen we use to generate patients from our system. You're able to easily filter to generate a batch of patient statements for all providers or a single provider. These statements will generate in the background and be available in a PDF or text view. So that way, if you are a small practice and you want to print out your own patient statements, you can do that. Or if you decide to use a third-party patient statement vendor, which we do in our revenue cycle management department, you can simply download that text file and upload that to the vendor's website. So next we'll talk about claims denials management. We manage most of our unpaid claims and denied claims off of aging reports, as most billing companies do. And so here we have a full suite of billing reports. I want to point out the aging reports particularly. We mainly use the primary insurance aging report and the secondary insurance aging report because those are the two types of insurances that most patients have. We do have some patients where we're having to use the tertiary insurance aging report, but we're able to use these to drill down and work a particular payer's claims or a particular aging bucket. So if we want to work all of the claims that are between 60 and 90 days old, to go ahead and get those paid since they've been sitting out there for a while, we can do that by generating. I'll show you that in the demo, how you can generate the report for a specific bucket. And all of our billing reports offer a multi-level analysis, and what I mean by that is that you're able to generate the report not only in a PDF, but you're able to generate them in an Excel spreadsheet. What that allows you to do is to modify the data to suit whatever need you have at the moment. We also have billing reports that are specific to billing. We have reports that are specific to patients and scheduling. So you have a comprehensive suite of reports that you can use to analyze your practice and the money that's coming in. We also have the ability, and I'll show you in the demo, where you can just type in a keyword and find all the reports that relate to that keyword. This is the pop-up that you get when you're defining the parameters of the report you're about to generate. All you have to do is plug in a date range, and you're ready to go. You're ready to generate the report. Everything else has the default setting, which you can modify if you want to suit whatever need, whether it be a report for 2 providers instead of all providers. This is the reports queue, and this is particularly powerful because we're able to generate reports. And while those reports are generating, we're able to continue working on your account. We're able to continue looking over and reviewing claims, billing out claims while our reports are generating. Here you see they are just queued for generation. And this is great too for the practice manager because he or she is able to generate these reports, let's say in the morning, and then when they get to the office, the reports are already there waiting on them. You don't have to spend time at the office waiting on your reports to generate. So they're automatically there because you've queued them up for generation. And like I mentioned before, they're available in PDF and Excel. So if you just want to print it out real quick in that PDF view, you can. Or if you want to take the reports and take it a step further for whatever needs you have, it's available in an easy-to-use Excel spreadsheet. I do want to step into the demo real quick, and I want to show you because that is the presentation, but it's always nice to be able to see the system itself. So here we have the patients list. This is particularly powerful for the billing department as well because we're able to drill down and see patients of a certain age, of a certain status or insurance. And so what that allows us to do is to find patients that are maybe at risk of a particular audit. Some patients will find, excuse me, sorry. Some patients may be at risk of an audit if they were diagnosed with a certain diagnosis, and there may be a recall on those products. We're also able to see the encounters list. This is where we're able to manage all of our claims. I can quick view a claim, and I can see that, oh, hey, this encounter does not the 25 modifier on that E&M code. So I can quickly edit that, scroll down, and this is where we're able to manage our ICD-9s and CPTs. And I can simply remove that modifier. And now I'm ready to mark this claim ready for generation. I do want to show you real quick, we're able to take advantage of Net Assets code check in our system. It comes integrated. So I'm able to click that, and it instantly alerts me to the fact that these codes are valid. If they were not valid, then I would not use them. This is telling me that I may have a need for a modifier, but as I know, I don't need a modifier on that code. The reason it's saying that is because the system will look and see if you have another CPT in addition to your E&M, because you sometimes, if you have a separately identifiable procedure, you want to document that with that modifier. So I'm able to quickly mark this ready and save and close, and that encounter is ready to have a claim file generated. So all I have to do is check the box, or in our case, at the end of the day, we'll sort this list to the ready status. This will trim our encounters list down to all the encounters that are ready to be billed. And all I have to do is select those and click our More menu and generate the EDI file, whether it's a 1500, a HCFA 1500, or if it's a UB04. We support both formats. Or if you need to generate paper claims, you can do that as well down here. The next screen I want to show you in this demo is the payments list. We talked about this during the presentation. We would post these payments. There are some practices where the office manager is expected to post these, but we believe that we filed the claim, so we're going to post the payment. We use our clearinghouse, and we're able to auto-post many of these. But when we do auto-post, we make 100% sure to review the claim, or I'm sorry, review the payments, so that we can be sure there's no mistakes made by the clearinghouse auto-poster. I can quickly view any payments that I want. So if I wanted to view this United Healthcare payment for $35, I just have to click on the little eyeball button to view it. I'm able to see all the payment details that we defined when we created the payment, and I'm able to see the 2 encounters that were paid on this batch payment. And you can see what's going on. Justin Brown, we received $35 for his visit. Mary Imaginary, we only received, we didn't receive anything. $55 of it was applied to the patient's co-insurance. And so you're able to quickly look at this as an EOB and find out what's getting paid, or whose visits are getting paid for. The unapplied payments list, this is where we would post or manage the unapplied payments that the front desk staff would be expected to create and post to the system. There are special situations where that doesn't happen, in which case we would just create our own unapplied payment and assign that to a patient. This is useful when you're trying to make sure you can collect and post money to the system even prior to the visit for copays and whatnot, so that your reports can be accurate. Speaking of reports, I want to jump over. Before that, we'll talk about pre-certs. I apologize. We have a full pre-cert program that can be purchased as a plug-in to our RCM program. It could also be purchased to plug into the product itself if you're doing your billing in-house. You're able to drill down and look at pre-certs for a particular provider, insurance, location. You can see at what status the pre-cert is in, because occasionally we will have to have some interaction with your office staff if we're missing some information. And then you can generate those in a PDF to view if you wanted to look at it. So we do have a webinar dedicated to the pre-cert service and products, so please see that. Contact here if you need the link to that. We do use the document section to be able to record EOBs that maybe have come in the mail for your practice, and so those can be viewed here, and we're able to post those to our system. The reports is where you'll be able to look and see what payments you have coming in, as well as maybe any missed appointments or anything. We have a full suite of reports. So if I wanted to look at all of the reports that are related to aging, I can do that here and look at my primary insurance aging and generate that. I have one generated in my queue right now that I'll show you. You simply click on the PDF and I can pop this into a new window. So you're able to see the primary insurance aging for all dates of service and providers. It's grouped by insurance in alphabetical order. So here I have Aetna, and I can scroll down and I can see that this claim was initially billed on this date and last billed there, and there's $150 for this claim that's outstanding in this 121 to 150 bucket. If I wanted to see the totals, I could. I have grand totals at the bottom. It sums up the dollar on the claims as well as the number of encounters that are outstanding so that you can see how many encounters you have outstanding for any particular bucket. I actually ran this report for the 151 bucket. So you can see that in the 121 to 150 bucket, all of my claims are in that bucket. Well, that's the 50,000-foot view of the Azalea RCM service. Kira, are there any questions?
I do have a few questions, some frequently asked questions. If you'll transfer that control back to me.
All right, there you go.
Awesome. Okay, if you wouldn't mind answering these for us. The first one is, why should I spend money for a billing service when it costs less to do in-house?
That is actually a really common question. We get asked that a good bit, and actually most practices will end up spending a good deal more money by doing their billing in-house. After you take into account having to split up the office's time, you have those staff members that will be stretched thin, which can slow down the other office workflow and patient care. There's missed reimbursement opportunities with that scenario. If you have to, you'll probably have to hire additional staff, which means additional salaries. We have an entire team dedicated to e-count here, whereas in-house you may have one biller that's able to you're able to dedicate to filing your claims and working those unpaid claims. And then last but sure not least, Azalea RCM specialists receive training and are up to date on all the guidelines. Our job is to ensure that your claims are submitted properly and to receive the highest level of reimbursement possible. So we're constantly examining your EOBs against the allowable amounts for, let's say, Medicare. So in the end, it does cost more to do it in-house.
Okay. And would I lose control of my billing?
You would not lose any control. Azalea simply acts as like a proxy to facilitate the claim submission. So you're reimbursed, the payments you receive go directly to your bank account from the insurance plans.
Okay. And what kind of specialties does Azalea support?
It sounds cliche, but we support all specialties. We actively bill claims and follow up on claims for all specialties of all different sizes, whether it's a one-doc practice or a multi-physician surgery group or a hospital-owned physician center.
Okay. And the last one is, how will I know if Azalea is doing a good job?
That's another common question. The transparency that is offered through our system and our processes allows you to, at any given point during the day, come into the system and find out if we're doing a good job. You're able to see the payments list, and you're able to view reports that will show you an analysis of your practice, and you can compare the payments that you're receiving to the adjustments and charges that are also in the system, as well as how many claims are going out, if we have filed all of the claims for a particular day or not.
Okay. Are there any more questions from our audience? Okay. Well, if there are no questions, I will go ahead and talk about our user meeting. It will be August 1st through the 3rd this year in Savannah, Georgia, and this is a perfect opportunity to get some hands-on training, especially if you are thinking about, if you are a current Azalea client and you are thinking about getting some additional on-site training, that you would have to purchase that, and whenever our trainer comes on site, you still have patients and you still have other requirements that are going to fill your day. If your staff were to come to the Azalea user meeting, that is a full weekend of completely dedicated training and learning about our system and learning how to do things the best way and the most efficient way for your practice. Additionally, if you are not a current Azalea client but you're looking for some health IT software or perhaps tech-enabled service, you can come to the user meeting and learn a little bit more about what we have to offer. You can speak with our current users. You can even meet our developers and make suggestions. So it's a really great opportunity. Also, I will mention that we will have another webinar in about 2 weeks. We have a few topics that we're throwing around right now. It hasn't been completely decided, but we will have it 2 weeks from today. And as always, if any of you have any suggestions for future sessions, please email them to marketing@azaleahelp.com, and we will be glad to take those ideas and turn them into webinars. Again, thank you all for attending this morning, and thank you, Lance, for taking the time out of your busy morning to be our presenter. Lance really gave us a great overview of Azalea's revenue cycle management services, and I hope that he was able to answer all your questions. But if you have more questions or you'd like to set up a one-on-one consultation with us, please email us at info@azaleahelp.com or give us a call at the 877-777-7686. All right, guys, thank you for joining us, and we will speak with you in a couple weeks. Have a good day.